I think it was a little sharper than most people expected to hear from him in wrapping up this very long 7.5-hour discussion, very detailed policy discussion about healthcare. And his message essentially was, hey, we'd love for you to cooperate. But then he went on to say, I know you probably can't for obvious political reasons, that a lot of the voters in the Republican base don't support this kind of sweeping overhaul of healthcare, and so their representatives in Congress probably will not support it and probably will not come very far, if at all, toward Obama's position. So what he said was, great if you can compromise, but we're prepared to go ahead if you don't, and we're going to. We're not going to do baby steps. That doesn't solve the problem in our view. We're not going to wait very long. We're not going to have a whole lot more discussion about this. And the bottom line for that is a very complicated and controversial process known as reconciliation, which is a way to get the bill through the Senate without any Republican support.
And there seems to be this sense that, okay, well, Democrats were going to go it alone right now, but they don't really have the support of every Democrat on this, do they?
No, they don't. And what's happening today is kind of a take the temperature period, and it's not exactly clear how long that's going to last. But there's a lot of work that the Democratic leaders on the Hill have to do with their respective caucuses to find out, are those votes there? If they're not, how can they get them? Are there deals they can make, whether it's on the issue of abortion or other areas where they can bring in, for example, in the House, there were several Democrats who voted no last time. Can they change any of those? Can they bring any Republicans along? Answer to that is probably no. But so there's a lot of maneuvering behind the scenes going on right now to answer exactly that question.
What's the risk of taking the reconciliation path?
Well, there's a risk that the public doesn't like it, for one thing, because it looks like it's ramming something through. There's some truth to that, but it's also been used a lot of times before on big issues such as tax cuts, welfare reform, I believe, under Clinton. Republicans have used it when they were in control. So it's controversial. You also have to remember that the Democrat still has 59 votes in the Senate. That is a majority. And so it's not exactly as controversial as people make it out to be, that you could pass something without a 60-vote supermajority.
Is there this idea that they would rather take the heat on sort of the process issue now rather than take the heat in November by having nothing to show voters?
I think that is the gamble, right? The president and right now his Democratic allies on the Hill feel like they promised they would do health care, they promised they would do it in a comprehensive way, and that they need to do as much as they possibly can to make good on that promise. Whether they can or not, and how far they'll go with this reconciliation plan, if there's a big outcry over it, they may not be able to stand the heat and they may pull back.
And if that happens?
The other option is to go smaller and to not have a comprehensive plan. Then it starts to look more and more like what the Republicans say that they want to do, and that may be a good way to go. It's right now it's the less preferred option by the White House. It also may not stand with voters as fulfilling Obama's campaign promise, so there's a little risk there too. But the risk of doing absolutely nothing may be larger. So there are a lot of political calculations that get very, very complicated.